Assalamu alaikum dear students, it's Dr. Masma Mehtab. Welcome to my YouTube channel Medical School. So today we are going to discuss about choleLithiasis and acute and chronic forms of cholecystitis. So let's go. Starting with the introduction, so the gallbladder is a pear-shaped organ in your upper right abdomen. Now it's located inferior to the right lobe of liver in the gallbladder fossa. Now here you can see this is the gallbladder which is located and inferior to the right lobe of liver. Okay, anatomically it is divided into three main parts. So we have the body here, and the middle part is the fundus, body and the neck. So the middle part is the body. Okay, then it is connected with the duct. Now this duct combines with the common hepatic duct to form the common bile duct. Now, what is the function of gallbladder? Now, it functions as to store bile, which is actually produced by the liver. Now, what is bile? Bile is an aqueous solution that consists mainly of the bile salts, phospholipids, cholesterols, conjugated bilirubin, electrolytes, and water. What is the function of bile? It actually emulsifies the fat. So fat is going to be broken down into small components so that the pancreatic lipase digest it. So here again, this is the gallbladder. These actually combine it's giving off the cystic duct that combines with these hepatic ducts to form common bile duct, and it's open to the second part of duodenum along with the pancreatic duct. So come to the main topic, that is choleLithiasis. That is a medical term that is used for the gallstones. Now the types of stones, we have three types, out of which we have cholesterol stones that forms 90% of the cases. So it's very common condition. And then we have the bilirubin plus calcium salts, and then we have the mixed stones. So the cholesterol stones, as we know, the cholesterol is a component of bile. What actually happens? So that cholesterol is going to be precipitate and form stones. So we are going to study about that. So these are formed due to the precipitation of cholesterol within the gallbladder. Now the reasons include stasis of the gallbladder. That means there will be poor contraction of gallbladder. Your bladder is actually not contracting very well, so it exits the bile into the cystic duct. And so this condition actually favors the precipitation of cholesterol. And the second condition is high levels of cholesterol, but there's low level of bile salts and acids. When there is low level of bile salts and acids, with whom the cholesterol is going to bind. So these all the conditions may lead to the precipitation of cholesterol and forms the stones. Okay, then we have the bilirubin stones, which are also known as the pigmented stone. They are much more less common as compared to the cholesterol type, but such type of stones are found when your liver forms too much bilirubin, so this precipitates with calcium salts to form the gallstones. Another type we have is the mixed type stones and have the composition of cholesterol, bilirubin, electrolyte. So whatever is the component of the bile that can precipitate together to form the mixed stones. So come to another topic, that is cholecystitis but acute forms. So that is a sudden inflammation of gallbladder walls, occurs due to gallbladder stone when it's lodged in the cystic duct, and that builds pressure, and distended bladder favors the growth of bacteria, hence there will be inflammation. So in this diagram you can see there is lot of stones, and but up to this the patient is asymptomatic. The problem arises when one of the stone is going and to the cystic duct and obstruct this duct. What happens? Your bladder is going to be distended, and there will be increased pressure that will compromise the blood supply of the bladder. So there will be complications. So we are going to discuss in a bit later. Okay, the presentations of acute cholecystitis, there will be severe right upper quadrant pain. I repeat, severe, that will radiate to the right scapula, and this is the main symptom of this condition. So that will help you in the diagnosis. And it is followed by nausea and vomiting, which is another diagnostic feature. Then the patient may develop fever due to increased leukocytosis. Now, after taking history, you have to go for the lab diagnosis to confirm the condition. So go for the LFTs, and you will see there will be increased liver enzymes, like we have serum alkaline phosphatase, and go for the ultrasounds that will show you the distended bladder, and blood testing will reveal the leukocytosis. Now, the treatment is symptomatic mostly to relieve the patient, and then you have to go for the cholecystectomy. That is the only remedy for this condition. Okay, the complication of acute can be chronic one. So the chronic cholecystitis is a chronic inflammation of gallbladder, and it's due to the long-standing cholelithiasis. Now it's characterized by herniation of gallbladder mucosa into the muscular wall. Now this condition is itself a complicated condition, but it also has some other complications we are going to discuss. So number one, we have porcelain gallbladder, in which your bladder wall is going to be enriched with calcium salts. Then gangrenous cholecystitis, as we have discussed that there will be less blood supply due to the distension and high pressure, so that may lead to the necrosis of your bladder. Then we have the perforation of gallbladder. Now remember, this is the complication of acute as well as chronic cholecystitis. Then we have gallstone ileus. Consider a scenario if your stone is actually going to the ileum and it's mechanically obstructing the ileum or the small intestine, so that may lead to gallstone ileus. So it develop a mechanical intestinal obstruction. Okay, then we have gallbladder malignancies, so you can develop cancer as well, and Myri's syndrome. Now this is another complication of chronic one. Now in this case, you can see here the gallstones are actually bigger in size. Now these, because of the long standing cholelithiasis, they have developed a large size. Now these stones are lodged into the cystic duct, but it's not actually blocking the cystic duct, it's also blocking this hepatic duct. So in this condition, there is much more complications, because not only the cystic duct is blocked, but the common hepatic duct is also blocked. So that I hope you understand very well. It was all about. Thank you so much. Allah Hafiz.